Domain knowledge and constraints of encounters. Domain knowledge. Domain knowledge of encounters. Encounters refer to the interaction between the patient and the healthcare provider. There could be multiple types of encounters as shown in the image. There are two types of encounters: consultative encounters, non-consultative encounters. Domain knowledge of consultative encounters. Consultative encounters capture the interaction between the patient and the healthcare provider. For instance, a patient interacts with a doctor and is diagnosed with a fever. Doctors can also prescribe drugs and recommend labs, etc. Consultative encounters are further divided into two types: dental encounters, non-dental encounters. Domain knowledge of non-consultative encounters. In non-consultative encounters, patients don't consult with doctors. They want to use any services, products, or want to take a test. These types of encounters are known as non-consultative encounters. Non-consultative encounters end directly as soon as staff members add the required utilities to the encounter and press the save button. Domain knowledge of dental encounters. Encounters that are conducted by doctors with dental specialties are known as dental encounters. Such encounters contain special tools such as odontogram. These tools aid doctors to interact with patients having dental issues. States of encounters. Following are the states of encounters: pending, ongoing, completed, closed, cancelled, no-show, queued, reopened, confirmed. Encounter tabs. There are multiple tabs of encounters, and each tab contains different types of encounters. In Queue tab. This tab shows all encounters which have the due time of today and are queued. Current tab. The current tab depicts those encounters which have the due time of today and are currently ongoing. Today tab. As the name suggests, today's tab shows encounters that are due today. Past tab. Encounters that were due before today appear under the Past tab. Upcoming tab. Encounters that are due after today appear under the Upcoming tab. Cancellation tab. All encounters which are cancelled appear under the Cancellation tab. No-show tab. Appointments that are marked no-show appear under the No-show tab. No-show means an appointment whose due time has passed and the patient has not appeared. Constraints. How to queue non-consultative encounters. Only admin, managers, and receptionists can queue non-consultative encounters. Only patients with complete profiles can have their encounters queued. Custom-defined utilities or drugs cannot be added to the encounter. How to queue consultative encounters. Only admin, managers, and receptionists can queue consultative encounters. Only patients with complete profiles can have their encounters queued. The reason is the mandatory field for queuing consultative encounters. How to start encounters. Only doctors can start the encounters, as a valid license is mandatory to start encounters. Doctors with invalid licenses cannot start encounters. How to end encounters. Only doctors can end encounters. The principal diagnosis is mandatory for ending encounters. How to cancel encounters. The cancellation reason is the mandatory field.